I'm Dr. Joshua Hess, and I will be working at the primarily the Mineral Point and Montford clinics at Upland Hills Health. So I actually grew up just right in the area. I grew up outside of Rui, Wisconsin, and went to Iowa Grant for school, and then I went to just kind of right down the road to UW-Platteville, and I got my bachelor's degree in biology. And then I applied to medical school, and I was accepted at UW-Madison, where I was a part of the rural program, the WARM, Wisconsin Academy of Rural Medicine. Before I started medical school, I worked in the emergency room as an ER tech for several years, and so I had that exposure of kind of the Upland Hills Health team, and I was just thoroughly impressed with everything that they had to offer, and really the family and the community. It seemed like everyone was very supportive and trying to work towards the same goal. My mom actually has worked here for at least, I think, 25 years. But I was actually diagnosed with a genetic condition called Marfan syndrome, and it's a genetic condition that affects the connective tissue in the body, and primarily in myself, it affected the heart, and so I had frequent doctor's visits growing up, and actually underwent heart surgery when I was 16 years old. So I had a lot of exposure on the patient side of the aspect of the healthcare setting, but just kind of through the entire process, I was just thoroughly impressed with the care that I received, and kind of just wanted to give back and kind of work towards helping others the way that I got the care that I had. Primary care, it's something that's always interested me, just because I like the scope of practice. I had a hard time narrowing the field. I thought everything was interesting, and so I wanted to be able to take care of all types of patients. But I have a particular interest in obstetrics, OB care, as well as men's health. And then also it's just kind of some specific kind of more health conditions, really weight loss and obesity, as well as diabetes are kind of some of my more fields that I'm interested in. I think my approach to healthcare is working as a team. We're in this together. I try to listen. I listen to what the patient's goals are, and my goal is to make sure that we achieve those goals. And so even if I don't know what the answer is, with primary care, again, you're seeing a big spectrum of conditions, and I may not have seen something before, but just because I don't know something, we've got a fantastic team that we can utilize and work to find that answer out. I think the most rewarding part of healthcare, and really the reason that I got in, is to actually make an impactful change in people's lives. Really taking them from the first time that you meet them, and if they're struggling with a certain health condition, figuring out what steps there are, and going over the treatment diagnosis and educating them and providing information. The goal is to get them to a point where they're happy and they're at their goals. But if not, then it's again, it's kind of a work in progress. Then we go to plan B, and we figure out what those steps are. So it's really, I would say, making impactful change in people's lives